So before we begin, let me show you an overview of my room. This is just a Snellen chart for the visual acuity test. Hello, my name is Nicholas Perez, and today I'm going to be a registered nurse. So before we begin, I'm going to wash my hands real quick, and I'll be right back. So I'm back. So what is your name and date of birth?
My name is Alejandra Perez and my date of birth is April 9, 2003.
Perfect. Can you show me your wrist so I can verify, please?
Yes.
Perfect, so everything matches. So what brings you in today?
So just a journal checkup.
Checkup, okay. Do you have any prior medical history?
No.
Do you take any medications?
No.
Do you have any allergies?
No.
And how would you like to be addressed today?
Alejandra is okay.
Perfect. So today we're going to be doing a head-to-toe assessment. We're doing a head-to-toe assessment to make sure everything is functioning as it should be. If you have any pain or discomfort during the entire procedure or assessment, so please let me know. So we're going to begin by doing your overall appearance. So overall, you look well nourished, the posture is relaxed, and there's no sign of agitation. So now we begin by measuring your blood pressure. Which arm would you like me to use?
Right.
Okay. Can you shut off the ceiling fan? Or hey Google, turn ceiling fan off. So I'm going to begin taking your blood pressure. If you have any discomfort, please let me know. Should be a light squeeze, but nothing painful. So your blood pressure is 110 over 64. It's within the normal healthy range. So now I'm going to be palpating your radial pulse. Okay, so your respiratory rate was at 14 and your pulse is at 82, as well as within the normal healthy range. So now I'm going to begin by measuring your blood oxygen levels with this oximeter. There should be a slight squeeze in your finger, but it should not be uncomfortable. So your blood oxygen level is at 99%, which is perfect. Of the range. So we're gonna begin the head to toe assessment by seeing the face, the head. So your face has facial. Your facial is face is symmetrical, and then let me see. I have to see the head. I have to palpate your head. Hair distribution is hair is evenly distributed, and in palpation, there is no palpable masses or lumps present. So now I'm going to be checking your oral cavity. Hey Google, turn saving fan on. So we're going to start off with the lips. The lips are pink and moist. Can you please open your mouth for me? The tongue is pink. The oral mucosa is pink and moist. The teeth are well aligned. And the tonsils are non-enlarged and no exudate present. So now we're going to also test the gag reflex. So open up and say ah. Okay, gag reflex is present. Right. And now we're going to begin to do the ears. So I'm going to inspect the skin on the ears. Can you please pull your hair back?
Yes.
So the skin is intact and there's no discharge. Can you please look to your right so I can see the skin is intact as well and there's no discharge. Now I'm going to palpate your ear. Can you please look to your left and let me know if there's any pain or tenderness when I palpate. Any pain or tenderness?
No.
Okay, can you look towards me? Any pain or tenderness?
No.
So there's no pain or tenderness bilaterally. So now we're going to do the eyes. So could you please put your glasses away for 1 second?
Yes.
So we're going to begin by checking your conjunctiva. So I'll need you to look upward for me. And I'm going to begin by shining a light and pulling your eyelid down. So the conjunctiva is clear, no discharge, and no redness. Clear, no discharge, redness bilaterally. So now could you please put your glasses on again?
Yes.
We'll be testing the visual acuity. So I have a smelling chart over there.
Mm-hmm.
I need you to cover one of your eyes.
Yeah.
Can you please read the 4th row?
LPED.
Can you please close your other eye?
LPED.
Okay, perfect. So now we're going to begin doing the perla. And we do the perla because we need to check if the brain and the eye are communicating as they should and functioning as they should. So I'm going to be shining a light in your eye to see if there's any constriction. Okay, it constricts. Constricts as well. I'm going to be shining a light again to see if your other pupil that constricts. Constricts. Constricts as well. So now we need to test accommodation. So we're going to focus on this pen light, and I'm going to bring it all the way to your nose, and your pupils should converge and constrict. Okay, so pupils are equal, round, reactive to light, and accommodation. So now I'm going to be testing your peripheral vision. Can you sit and face towards me, please? So let me know, you focus on me, but tell me when you stop seeing the pen in your peripheral vision.
I can see it.
Can I see it? Okay, perfect.
I can see anyone.
Okay, perfect. So that is it with the eye assessment. Now we're going to move on to the thorax. So could you please sit down for me?
Yes.
So first we need to examine if the chest is symmetrical.
Mm-hmm.
So chest is symmetrical, breathing is unlabored and regular. So now I need to check for the thoracic expansion. For the thoracic expansion, I need to sit facing away from me. Okay, so I need you to inhale. There's thoracic expansion, symmetrical, bilaterally. Okay, so you can sit back down. Now you're measuring your lung sounds. We're also taking your lung sounds. Okay, so every time you feel the diaphragm of my stethoscope, I need you to inhale. So anteriorly, there is clear lung sounds, bilaterally. So could you please sit down and face away from me?
Yes.
I'm going to be measuring or auscultating your lung sounds posteriorly. Okay, so breathe in every time you feel the scope. As well, lung sounds are clear bilaterally. So now I'm going to percuss here. No, stay in that position. You do the percussions. Let me take off these gloves real quick because they impede the percussion. So the lung sounds are resonant. So let me wash my hands real quick and then I'll put on the other set of gloves. Stay in that position because for the next test.
Okay.
So I'm going to be auscultating you again, but every time you feel my diaphragm, I need you to say blue balloons. We need to check for the vocal fremitus.
Okay. Blue balloons. 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 Blue balloons.
Okay, perfect. No excessive vibration noted. So can you please sit back down for me?
Yes.
Now, when you feel my diaphragm, I need you to say the word 99. The number 99.
Ninety-nine. 99. 99, 99, 99, 99.
Okay, perfect. So now we're going to begin with the inspection of the breast. Have you had any pain or tenderness in your breast?
No,
Any lumps that you've palpated?
no,
And based on the you see your chest, your breast, there's no lesions or palpable masses present. So now we're going to begin assessing the spine. So if you can you please sit down facing away towards me?
yes.
So I need to inspect the spine. Can you pull your hair away and lift your shirt up so I can see? Spine is visually it seems aligned and no deformities present. So I'm going to begin by palpating. So there's no palpable masses and it is well aligned.
Okay.
Okay, you could pull the shirt right down. Now you could please lay back down. Now we're going to begin with the cardiovascular assessment.
Okay.
So we're going to begin by measuring your distal pulses. So could you please put out both arms so I can measure both radial pulses? So it is +2 and regular rate. And we're measuring your pedal pulse. So it is +2 and with a regular rate. So now we're going to begin by measuring your capillary refill. Okay, capillary refill is under 3 seconds. So now we need to check for edema and so edema is not present. There is even hair distribution. The skin is appropriate for ethnicity, and the temperature is warm. So now I'm going to be auscultating your heart sounds. So I'm going to begin with your aortic. Your pulmonic, herbs, tricuspid, and the mitral. So S1 and S2 sounds noted. There was no murmurs present. Yeah. So now we're going to be switching to the musculoskeletal system. So in my inspecting, so the muscle is symmetrical and there's no signs of atrophy. So now I'm going to become palpating. Please let me know if you have any pain or tenderness when I palpate the muscle. Any pain or tenderness?
No.
You're going to do it with your arms as well? Any pain or tenderness?
No.
So now I'm going to be palpating the joints to see if there's any pain. Let me know if you have any pain. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Okay, so no pain or tenderness noted. Perfect. So now I need to check your range of motion for your joints. Can you please sit facing towards me? So could you please lift your arms and extend your elbows? Yes, like that. Any pain when you do that?
No.
No. Can you do the same thing with your knees?
Mhm.
Okay, perfect. And no pain there? Or is...
No.
Okay, perfect. So now I'm going to be testing your strength. So could you please put your arm and push against me? Okay, perfect. Now pull towards yourself. Perfect. So muscular strength is a 5 out of 5 bilaterally. Okay, so you can please sit back down. We're going to be doing the abdominal assessment now. So if you can, since these are high-waisted pants, can you lower them to expose your abdomen? And put the blanket right towards the, you know. So I'm going to begin with the inspection. Visually, there's no distension and no lesions present. So I'm going to start with the auscultation. Normal active bowel sound present. So now I'm going to start with the palpation. Please let me know if you have any pain or tenderness. Any pain or tenderness?
No. No.
Pain or tenderness? Okay. Now I'm going to become a percussion. So there's tympanic sounds noted. So now you can take this off. We completed the abdominal assessment. Now we need to do the neck.
Okay.
Could you please? So trachea is midline. There is no palpable masses. And now face towards me and you gotta check your lymph nodes. You look towards me? Okay. No palpable lymph nodes noticed. You can sit back down. So the next step is the neuro. And skin. We need to start with skin. So skin is normal for ethnicity and there's no lesions present. Now we can do some neuro questions.
Okay.
So just a couple orientation questions. Do you know what's your name?
Yes, Alejandra Perez.
Do you know why you're here?
Yes, for general checkup
Do you know where you are?
in the hospital.
You know what day it is?
It's October 7, 2024.
Okay, perfect. So that is alert and oriented times 4. So now we need to do your Glasgow Coma scale.
Yeah.
So I'm going to give you a 4 for the eyes because they're open spontaneously. That's a 4. And a 5 for the verbal response because you're listening and answering to my command. And a 6 for the motor function because you follow. Okay, so like nod your head. So you follow command, so that's a 6. So that means you'll get a 15 in the Glasgow Coma scale, which indicates that you're fully conscious. So also we're going to be testing your cranial nerve 5. So I'm going to be pressing a cotton ball on your head. Please let me know when you feel it. Close your eyes, please.
Yes. 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 Yes.
Now I'm going to be poking a sharp stick, so say yes when you feel it.
Yes. 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 Yes.
Okay, so now I'm going to switch between the cotton ball and the sharp stick. Please, when you feel the cotton ball, stay soft. When you feel the stick, stay sharp.
Soft. Soft. Again. Sharp. 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 Soft. Soft.
Okay, perfect. So now we need to check your ocular reflex. So I'm going to look ahead and put a little piece of cotton ball in your eye, and your eye should close when you feel the cotton ball. Okay, the eye closes, it indicates that your ocular function is perfectly fine. So now we need to check cranial nerve 7. If you can you please raise your eyebrows for me? Could you please close your eyes as hard as you can? I'm going to push against it. Okay, perfect. Could you please frown? Could you please smile? Could you please puff out your cheeks? Okay, perfect. So then now we need to do the Romberg's test. Can you please stand up for me, please? So I need you to put your feet together. And I need you to put your arms out and close your eyes. Okay. 1, 2, 3, 4, 5. Okay, perfect. That is a negative Romberg test. And there was no swaying or loss of balance noted. So I need to ask you a few mental health questions. How has your mood been lately?
Good.
Good. Have you had any anxiety lately?
No.
Any sleep disturbances?
No.
Any drug usage?
No.
And have you had any suicidal ideation?
No.
Okay, perfect. So that is the completion of our head to toe assessment. I need to document all the findings. If you need to call me or need any assistance, there's a call light button and you can press and I'll be right back.
Okay, thank you.
You're welcome.